Hi, Dr. Dave Webster again. I'm a PET CT specialist in the province of Ontario in Canada, and this is a follow-up to a previous blog which I entitled Serial Cancer Rounds. In this particular video, we're going to be talking about Cancer Care Ontario, or CCO. One of the questions I'm going to want you to consider is whether Cancer Care Ontario is a friend or a foe, in fact, of our cancer patients. Now, I've been fighting the Ontario government for the past 15 years, and virtually politicians from every party, but to try to defend how they have handled PET in Ontario. Ms Wynne, our current Premier, and Dr. Eric Hoskins, our Minister of Health, they have the audacity to call their approach to this issue as a patient's first action plan for healthcare. So we'll see about that. The reality simply is that Ontario patients have the most restricted indications for PET-CT, which is in fact and has been the accepted world standard of investigation and management of cancer and other serious diseases for as much as 20 years in the civilized medical world. So, but how can this be? Well, this is where we're going to look at the role of Cancer Care Ontario, whether they were assessing or in fact blocking PET. So again, another question I'd like you to consider is Cancer Care Ontario's role to determine what is best for Ontario's cancer patients? Or is Cancer Care's role to be mouthpieces for the Ontario Liberal government policies on health care? So this is Dr. Michael Scherer. He is the President and CEO of Cancer Care Ontario. This is Mr. Ram, the Chairman of the Board. He'll have lots to say about them over various blogs. But their motto currently of Cancer Care Ontario is "Our Future, Health Built with Care." We'll see. One of the things CCO would like you to believe as part of their mandate is about the timely access to, in this case, PET. Now this is Dr. Aldridger, who was the most senior member of one of Cancer Care Ontario's committees evaluating PET. It was called the PET Steering Committee, and he wrote the Liberal Minister of Health, Mr. George Smitherman, and stated that, quote, effective review of new technology needs to be with that new technology at the cutting edge and not lagging a decade behind, as is the case with PET today. Now keep in mind, that's in 2004. He's referring now that we're sitting sort of back at the 1994 level in the rest of the world. So another thing I'd like you to believe is that it's patient-centered. Now, does that vaguely sound like this patient's first concept of Ms Wynne and Dr. Hoskins? So a brief history of Cancer Care, their involvement, I'll have other details on this, but in the late 1990s, Dr. Aldridger chaired a multidisciplinary committee consisting of our best imagers in Ontario and top cancer specialists, and they thought, okay, what does the medical literature have to say about uses of PET in cancer patients and other things, actually. But they would determine that about 40,000 patients would immediately benefit from a PET scan. So they arrive at a meeting, they're all excited, we're about to roll out PET like the rest of the world has done, like in Chile and Argentina and places like that. And what happens, in fact, is a Minister of Health official shows them a slide of a 35 mil slide of a poster PET presentation at a medical meeting from Australia. And this author was working on the idea that they didn't think PET was useful for lung scanning. So for those of you who are not familiar with medical posters, this is what they look like. And as you can see, they're just tacked up on a board. They may be 1 or 2 pages on Bristol board, and they're working on an idea. These are not, I repeat, not scientifically valid papers. They're simply ideas people are working on. However, this poster on a couple of pieces of Bristol board was all the government required as an excuse to stop PET cold in Ontario. So let's look at how that happened. It turns out that Mr. Tony Clement, he was then the Minister of Health for the Conservatives, and what he did was he called key CCO physicians to a meeting after he'd read that report. And now Mr. Michael McCarthy was Mr. Clement's senior aide. Some may remember Mr. McCarthy. He was a very prominent man. He was in fact the one who dealt with the hepatitis C blood scandal for the government, very respectable man. So what happened was the Ontario Association of Nuclear Medicine, we hired Mr. McCarthy as a lobbyist, and at that time I was the president of the ONM. The point is that the ONM executive, we knew exactly who was at these meetings with Mr. Clement, and we know exactly who said what. So what did Mr. Clement tell the senior CCO executives? Basically, it's as simple as this. The government is not going to pay for PET because of cost concerns. And yes, those of you who guessed long ago it's about money, it always has been and always will, of course. Patients are the last to be considered. So Cancer Care Ontario at that point was given the task of discrediting, delaying, and blocking PET. Now, what they would do is they would partner with colleagues and physicians and scientists and so on from McMaster University Evidence-Based Medicine Department as to how they were going to carry out this mandate to block PET. And they would use something called the Health Technology Assessment, or HTA, and it's a type of so-called evidence-based medicine. Now, it kind of sounds like motherhood and apple pie, doesn't it? I mean, who wouldn't want the best evidence to make determinations, about serious decisions about what healthcare you have access to? So they would set up these so-called evidence-based medicine committees. One of the key committees will be the PET Steering Committee, first headed by Dr. Bill Evans as the chair. Now, they are the committee that basically designed the experiments on cancer patients. Now, in fact, these experiments, way back in 2005, were officially declared unethical. I have a lot more to say about that. But in 2009, in fact, Dr. Dreger will resign from the committee in disgust. And what he will say, and shocked his college, I can assure you, this was said publicly, was what those who are assessing PET are doing borders on immoral. And remember, that's back in 2009. Now, there's another committee called ICES, Institute for Clinical Evaluative Sciences, and Dr. Andreas Lopakis was the first president and CEO. Now, they would evaluate the world literature published about PET, and in fact, they published the very first report in 2005 about the uses for PET after that 40,000 were introduced back in the late 90s, remember. And I can assure you Dr. Lopakis is very proud of this report, but they took the 40,000 patients recommended by the independent panel of experts, and they reduced it to 0. Not 1, not 100, but 0. And yes, that medical poster played a key role in that. Now, but is the HTA health technology assessment based on science? What I can tell you is no one is even trying to pretend that it is. There is no scientific validity whatsoever to justify using the HTA to assess PET, CT, or any diagnostic imaging technology. In short, CCO and McMaster experts have used a scientifically baseless tool to evaluate the quality of evidence of the medical literature on PET. And what that's done, of course, is left Ontario patients with the most restricted indications for PET in the world. And that's not actually the bad news. I'll have more to say about that later. So if CCO and McMaster University medical experts aren't using science, how do they evaluate the rules for PET for Ontario patients? This is a critical individual in the world from Australia, Professor Rodney Hicks. He's certainly one of the most respected people with PET, dealing with PET in the world. And what happened with he was similarly trying to get their government way back, who was trying to block PET as well. And his efforts to expose what they'd done, in fact, led to criminal charges against several of the Ministry of Health experts. So keep that in mind as we go through my various blogs, that criminal charges were in fact laid, and should have been. So in 2016, Professor Hicks emailed me and he said, Ontario has the most egregious and politically motivated agenda against PET in the world. Now clearly that's worth repeating from this world expert. Ontario has the most egregious and politically motivated agenda against PET, and of course, read our patients, in the world. So the response of Cancer Care Ontario to my efforts to act as patient advocates, you'll see a lot more about that, they have threatened me. So if I continue to speak to physicians and patients about PET or how they're evaluating it, or use PET images, even if there's no identifiers, I will no longer be able to work at an Ontario hospital. And yes, this truly is the kind of province that you really live in and the kind of people that are making decisions about your health care. So, but it also begs the question, if CCO and their McMaster colleagues have spent all these years blocking cancer patients from the accepted world standard of imaging management for almost 20 years, just what else have they done to some of our sickest and most distressed patients? Think about that for a moment. So, back to my original question about Cancer Care Ontario, is CCO's role to determine what is best for Ontario's cancer patients? Or is CCO's role to be mouthpieces for the Ontario Liberal government policies on healthcare? So my next video, what I'm now going to do is I'm going to show you what the impact on our patients has been from CCO McMaster experts using blatantly unethical and bordering on immoral and an agenda-driven process directed squarely at our patients to discredit, delay, and block PET. So thanks, and I look forward to your support on this.